In regards to facelift, this is a terminology which I don't like to use. I prefer the term facial rejuvenation because the aim of my surgery is to restore and provide to the patient the rejuvenation that has been lost with aging. One of the important factors of the aging process is loss of volume and the dropping of the tissues in a vertical downwards direction. Therefore, my approach is to provide this elevation in the upward direction to reposition the soft tissues in the original position where the patient had it when they were very young. When I do this operation, I do it using smaller incisions using endoscopic instruments. That way, I could do the forehead with tiny incisions placed in the scalp to elevate the brow, remove the frown lines, reposition the brow position, and provide the rejuvenation of the upper third of the face instead of using this big coronal incision, which has been the traditional way to do it. Now, for the mid-face, the way that traditionally is made is with this periauricular incision around the ear, which the tension of pull is more in a horizontal direction, which gives to the patient this windswept motorcyclist look to the face, which is non-natural. I prefer the vertical direction because the tissue drops in a downward direction. I do it in the opposite direction, and that provides not only the repositioning in the better position, but also provides volume to the face. That volume has been lost with the gravity. Now, many patients during the aging process, they lose considerable amount of fat on the face. Now, this is the opportunity to also use fat grafting techniques. This fat is obtained with a small syringe from the abdomen or the waistline, processed at the side of the table, and this fluidified fat is re-injected into the face to provide this volume that the patient has lost with aging. Therefore, at the end of the operation, you are not only rejuvenating the face, but also beautifying the face, because part of the aging process is that makes the face less beautiful. So rejuvenation and beautification goes along in my operations.